Welcome to the Healthcare Business Analyst demo class. My name is Rajiv and I'm the instructor at Vulcan Consulting. We are going to talk about business analyst, the healthcare domain training class. We are going to try to cover it within 20-25 minutes, followed by questions from each one of you. So if you see on your screen, it's going to be a 25-minute class, followed by, if any questions, it can extend to 30 or 45 minutes. I'll cover the class agenda. I'm going to show you the resources available, followed by questions from you guys. For productions, I have touched base with you individually, and I know what is your geographical location, what are you looking for, and what is your background in related to informational technology, related to IT. So again, for a business analyst, you do not need any IT background. You do not need any coding. All you need is, smartness and good communication skills, which I believe all of you do have. On your screen, I'm just showing the structure of the class, which is going to be, if there are going to be two batches, either going to be a two-week class, or going to be, if you choose to do over the weekdays, it's going to be 6 weekdays. Like, we will start from Monday to Friday, and then we'll try to cover it in 2 weeks. Weekends, we do 10 a.m. to 4 p.m. with a lunch break, usually 50-minute session followed by a break, and of course, lots of assignments. So, just a snapshot of what this demo class is going to be. We are breaking into 4 parts. We talk about what is a BA from the start, what are the roles and expectations, what are the business areas in healthcare industry, what are the different healthcare domains, like for example, we have dental claims, chiro claims, optometric claims. We talk about different business areas, enrollment, benefits, claims, providers, finance, because these are the concepts you have to walk in with the interview to secure that job. We dig deep on the second day and we go into the claim engine and the claim processing details. They talk about BA and the real-time project. So what's happening here is day 1 we talk about BA, day 2 we talk about the domain, which is healthcare. We combine the both. Online in other companies, you're going to find basic BA training. It has to be domain specific. You cannot just walk into an interview basic BA training. This is the resume preparation and job hunting. So we'll try to dig deep into this. So before I begin the class, I want to let you know what you're going to sign up for. So the first thing I want you guys to do after this class is you go online. These are the companies you applied to through Sulekha, right? Attend classes. Are you guys seeing a Google Chrome screen with Sulekha at the background? Yeah. Talk to these people, attend their demo classes, and talk to your friends. Hey, there's this guy who is telling me it has to be domain specific. Is that so? I'm sure you have friends working in the IT industry. Companies, I'll see. Here I am. I'm just like any one of them. How will you make your distinction on how to select the company I work with? Attend their demo classes, right? Now, when you sign up with us, we put you through. We go domain specific. We just do a basic BA training. Now, if I go online and if I put in what does a business analyst do, I'm going to get a basic description of what's going to happen. Now, on your screen, I'm going to show you the material you're going to get as a part of this class. All right. We have basic healthcare chapters. We have like 27 essential chapters for a healthcare candidate who should understand what happens in the healthcare world. So those are the chapters which I'm not going to go through because this is all theory. We are going to talk about the basics of BAs and have numerous BAs, which are business requirements documents, which are the deliverables of a business analyst, which you're going to work step by step from scratch. You're going to build up a BRD and going to go through all different projects. So it's healthcare. Once, let's say you say that I have family, I'm limited, I cannot relocate. We go into other domains. After healthcare, healthcare, we jump into telecom, we jump into state projects, we jump into finance projects. So these are the different projects that we have in different domains. You know, what you say here is once you exhaust one domain, shift to the other. We are saying here we are going to do train in a domain. Now let's pick up an example. From scratch, BRD. On screen you have a Chiro BRD, which is a chiropractic BRD done by a candidate in the previous class. This is BRD you follow. We have a discussion in the class. You have a draft of the BRD. These are the requirements entered by the candidate, and in class, while I'm teaching the person, these notes were done, these assignments were submitted. This is BRD built from scratch. After BRD, the next step is coming up with the testing document. So this is a test plan exercise sent to the candidate. I send them the template. I give them 2 examples, and they come back with the full assignment, which is this one on your screen. The test case and is the assignment covered. So let's pick up what's there online. You'll see what is an SDLC. Okay, this is the definition of SDLC. I mean, know half of the things here because it's all theory. Traceability matrix. What is traceability matrix? Okay, correlates to baseline documents. Not to ask you this in the interview. We a traceability matrix from scratch. Here's the matrix for a project. We start up with the BRD. We start up with the requirement document. We go to the functional requirements, and we set up to the testing document over here. This bit of information and this kind of templates are the ones that you get when you sign up into this class. When your homework and you talk to other companies, make sure and try to see if they're covering these similar things that we are mentioning on the screen. Okay. So numerous documentations, numerous assignments. Again, it is going to be like 20% what I teach and 80% what you do on your own. Okay. So this is a healthcare company's main business area. This is the claim engine. This is like a $4 to $5 million application that the company runs on claim engine. So we dig deeper into what each business area is, and we go deeper into the business areas, trying to understand what fits where in an organization. So that was a summary. Now, if I just want to expand a bit more, please, I want you guys to pay attention, because in this demo class, I have a small quiz to ensure you guys are getting everything I say. So be very, very attentive, please. Now, and as I said, we talk about what a BA does. What is a business analyst? How is the IT umbrella fitting in an organization? When you pick up and you go to Walmart, things are scanned, you purchase things. There is some stock level maintenance done in Walmart. There is when you buy an iPhone, the pictures of the iPhone, they were designed by the IT team. How was requirements written? What kind of domains can we explore? We go through that. What deliverables of a business analyst, right? I showed you 3. I showed business requirement document. I showed you the test case document. I showed you the traceability matrix. We dig the healthcare industry, the fear and the need of IT in healthcare. They dig deeper. We go and see that, okay, you say you clear the interview, you enter the company. What to expect? Different subject matter expert areas that you're going to work with. This is rocket science. This is only, smartness and good communication skills that will help you sail through this job. Meetings, escalations, emails, follow-up with them. Now, while you just walking into a room, 20, 25 people sitting in it, how does that, how do you perform as a business analyst? We go to the BA etiquette. Like, for example, if you walk into a meeting, you need to make sure everyone has the agenda of the meeting. Everyone has to make sure what is going to come out of the meeting. You should take meeting minutes after that meeting. And, that's a very common question. What do you do after a meeting with the business? The answer is, well, I'm sure I have the right questions and answers. I take notes, and after the meeting, I send the meeting minutes to get approval from the business that, hey, did I get everything correct? 90% of the time, the business is going to come back and point out a mistake. Oh, you know what? This was for national candidates, not New York or New Jersey. And fine, that is the day-to-day life of a business analyst. They dig deeper into claims processing. Now here it's getting here-based to technical. We talk the actual filing of a claim and a referral. When you go to the doctor, what happens? You show your insurance card, he gives you treatment, you come back. What happens at the back end? Walk into a Walgreens or CVS or any other pharmacy. What happens when they tell you wait 20 minutes, we will give you your medicine. Take the medicine from the counter. What happens in that 20 minutes? What are they verifying? Are they verifying eligibility, your membership, your insurance, using person who is having insurance, kind of a thing. With the claim flow from the start to the end, you're sick, you get sick, you go to the doctor, you get your treatment, you come back home, and everyone in this cycle involved gets the payment. We talk about different companies, NASCO, IDX, QCare, QLU. Like this is that blue screen, which I said it's worth millions of dollars. That every so this simple example. In a healthcare companies, can you think of United Healthcare, Blue Cross Blue Shield, Aetna? These 5 basic steps. You have the plan, employer, member, referral, and claim. Now, in each, what happens is, let's look at the example at the bottom. 621, ABC Corporation, entity with McDonald's. My name is Mark. I have referred to see a specialist, and I go visit the doctor for an X-ray or an office visit. A claim. The doctor is a claim for me. That I visit him. I got cured, and now he wants the payment for the services he did. Now, the typical flow of information in a healthcare company. Now, on the screen, deeper into one patient, for example. This is how the healthcare company claim engine looks like. You can see this. In the middle, you see the PCP, which is the primary care physician, which is the doctor. At the right side, you can see who is the employer, what is the effective date of the contract, is the person, does the person smoke, what is the name of the person, what's the address, what is the social security number, is of course the name of the patient. So all is revolving around the claim. What is a claim? What is adjudication? Adjudication is the processing of the claim. What is it? Just the pharmacy example I gave. It is nothing but checking whether the member who is receiving the services is eligible or not. The claim processing engine. We look at different types of claims: dental, professional, institutional, stat, non-stat, mixed, anatomy of a claim. And so each claim has 37 different screens. A claim, a bill for services then to a member. So can anyone answer this question? Who gives the member the service?
The employer?
No, the doctor, the provider. So the employer is the one who pays for the insurance, but the person who gives you the services is the provider. The claim is submitted by a provider, the healthcare company. Of course, a specialist through a referral. Like, I cannot just go to a hospital and say, I need an operation. They will tell me, go to your doctor, come with a referral, and then we will look at you. The claim is the goal of adjudication of the system. A quick exercise right now, okay? Example of a patient going to a doctor. A doctor is also known as a provider, okay? And HMO member is the member, let's say me. So we are aware the vendor or the provider or the doctor performs a service for an HMO member, which this means the person has insurance of HMO type. The doctor and gets service. The doctor submits the bill or the claim to the company. It is entered into the system, and when claim is entered into the system adjudicates it to determine the payment or outcome of the claim. So simple flow: vendor provides service, vendor gets the claim, healthcare company enters the claim into the system, and determination of payment or outcome of the claim is done by the system. Put in a scenario here. We have a called through. He needs knee surgery. He has insurance with BCBS company. He goes to United Hospitals. Dr. opts on him, and BCBS uses Q, the blue screen, Q for claims processing. Okay. So when in the third box, this question is for Mansi. Mansi?
Yeah.
The third box, claim is entered onto the system. When you claim is entered into the system, what is the system on this screen?
The blue system.
Correct. Q blue is the system. Very good. So, okay, the second box, this would be for Sushma. Sushma?
Yes.
Okay. The second box, the vendor submits the bill. When you're a vendor, who is the vendor on this screen?
I don't.
That's the member. The vendor is the provider. Can you tell me who is the provider?
Dr. Allen.
Dr. Allen, right. So there's the guy who will come up with the claim and submit it to the healthcare company. Okay. Now, all right. I think that's enough. Now we proceed to real-time projects. As I pulled up the different BRDs we have, these are different BRDs we have. We go to each one of them and cover all the different types of requirements. In these BRDs, we go through what does the BA come up with, what are the different checklists that he should take care of. We look at different types of projects: Medicare, Medicaid, ID cards, enrollments, claims, provider module, benefits, underwriting, finance. All these different types of projects fall under the healthcare company. We discuss them. The business analyst does not join at the same point of a project. You can join even at the end of the project, and they want you to do some documentation that they never did. What the does in various stages of a project, from start to end, where do you fit in? Okay, one of the most common projects is the ICD-10 project, which is, we have the procedure codes and the diagnosis codes. ICD-9 are replaced by ICD-10. Many will have gone live with this. Basically, what we are saying is, in examples at the bottom, it goes from 3 to 4 digits to 7 digits. What does that mean? We are increasing the variety of an injury. In ICD-9 world, you say, I have a fracture on the right hand. In ICD world, you say, I have a fracture on the right hand in the 2 fingers. More detail. That's all. That's just more detail. We look about the deep structures, and this only comes in when you're interviewing for such a project. We don't unnecessarily merge all this into your head. Now, next thing is job hunting. It's out to give you the training and put you through. One thing I want to say: what is the good here? Right now, you have a paycheck. You don't have a job. You need training. You need me to put you in the market. I make money from you in the first 12 months, 18 months. After that, you do not need me because you have a good network of vendors, you have a good network of companies. You are on your own. I came here to do my MBA 15 years ago. I this learned as much as I could and then branched on my own. Once you have 2 to 3 years of experience, you do not need many to get a job. You just call your vendors, hey guys, I'm back on the market. Before it's online, it comes to you. But for now, I help you prepare a resume, a 30-second pass resume. Look at your resume, and it takes 30 seconds for them to tell you that, okay, this is good or this is not. Writing my network of vendors. To you now, you don't need me. Network of vendors. What you need to find a job, how to jobs in your location, how to apply for jobs, how to follow up with recruiters and phone calls, the main prime vendors, everything I give it to you. In a nutshell, these 9 to 10 deliverables is what we are going to make or come from this. We start with test plans, traceability matrix, UAT plan, minutes documentation, data process flows, how to send mail, uses, user stories, etc., etc. Now, keep in mind, all trainings, as I said, attend those demo classes. Compare notes. This is not easy. I mean, your time is not free. You have to work hard for it, right? Now, the cost of training, it says $300, but this is a retainer. What does a retainer mean? A retainer, you pay, you get all the documentation, you start the class. At any given time, you back, you're not happy with the training, you found another job, or you're no longer interested. You drop me a mail, the money is refunded back. Our support is available. Once you join a project, it's to make sure I review all your deliverables and you send the right emails. Everyone out there, they're going to tell you we will refund your money, your training money, after you get your first project. Do not do that. $300 is not a big amount for me. And so those free trainings, and then see their quality. And then it's a difference. I mean, if I have you can see this was a free demo class. Not even was there at 11, right? When you class, you have 20 people coming in, and there's learning that happens. So unfortunately, this retainer has to be there. I'm going to take some questions from you guys. So, Shah, can we start you? Did you find this informative? Any questions so far?
The presentation, of course, pretty much clear. But with the class thing, like once we enroll, right? I mean, right. Say I go ahead with this. So the times that you showed earlier, those are the times that now you have the class?
Right. So we'll have 2 batches, weekday and weekend. So, offline we can catch up and see which one, where you fit in and put you accordingly.
Okay. And in terms of the presentation, do we get them as a copy, or is it only class wise?
Do what?
No, the presentation, the PowerPoints.
You get the PowerPoints, you get the recordings, you get like 3,000 pages to read.
Okay.
Any other questions for Darsha?
Not at the moment.
All right. But Sima, what about you?
My question, my question would be like, see, I told you I'm a dentist. I don't have any knowledge in software. So for a person like me, how many days would it take to learn everything and apply for a job?
That cycle depends on how sooner you do the assignments. I mean, in this presentation, we covered the entire class. Do you see anything that was out of your understanding?
No.
Right. So everything is going to be in layman's language. There is no point to lure you into this class and it's not meant to be for you. If you're a dentist, that's pretty much good, but you're from the provider side. I might go through something in the class and you might come in and say, you know what, it doesn't happen this way, it happens that way. So this is definitely not something that you cannot do. I think being a dentist is a plus for you and you can definitely do this.
would be the salary like for these jobs?
So when we start on a project, we start in a ballpark of around $33 to $35 an hour, which converts to 70 grand. The goal here is within 12 months, I have bump you up in between $42 and $45 an hour, which is 90 grand. Because after that, my involvement with your job will be very minimal, and
Okay.
I have you up there at $45 an hour. You continue the project because if our company is making extra $4 or $5, you wouldn't mind because we got you that project, right?
Yep. Yep.
That's pretty much numbers with these kind of jobs.
Okay. And my last question. Do you also provide any training in this HIPAA, EHR, or EPIC services?
So we cover HIPAA, we cover healthcare information exchange, we cover electronic health records as well. This again, it's project to project. We say, do you know HIPAA? That doesn't exist because HIPAA is just like a cop in the healthcare company. We go through 5 different modules of HIPAA and dig deeper into what HIPAA means.
Okay.
Any one?
That's it. Yep.
All right, good. So what about you?
Question is, are you teaching about that NASCO thing?
The question?
Teaching about NASCO.
Yeah, NASCO is the claim engine of Blue Cross Blue Shield companies all over the country. So, in Michigan, in Jersey, in California, all CBS companies use NASCO. In fact, I have hands-on experience with NASCO. We will cover NASCO, but do you have any specific questions regarding NASCO?
So, what are your timings, like days timing?
We will touch base on the timings offline because all this week I'm doing doing the demo classes. Then I want to touch base with everyone and see where I can put them. So we take the timings offline because every day I'm talking to many people on this.
Okay.
Any other questions, Sadia?
No.
All right. What about you?
Okay, so I would just want to know that do you only basically do healthcare company?
With telecom, finance, marketing, retail, all the domains out there. The goal is to have you get your job.
Or begin with healthcare training because what I want to begin with another domain.
So see, the healthcare, the reason being that, half time of the class, you're talking about a business analyst. And expectations. After you're done with that, that's when healthcare kicks in. So at that point, it's going to take, I think, just 2 classes to wrap up the healthcare domain and move on to the next. But the assignments, the process flows, the traceability matrices, BRDs in the healthcare domain are going to be the same across the world. So across all the domains, these assignments are going to be the same. So we begin with the healthcare and then we dive into telecom or finance. Now, let's say you have a location XYZ and you cannot relocate out of there and they do not have any healthcare jobs. Then you with the other domain like telecom or finance, Yeah.
Yeah. Excuse me, Rajiv. This is Sushma.
Yes, Sushma.
I have a question regarding this change of domain. Suppose if I don't find the jobs in my area and I don't want to change from healthcare, then what is the option?
We wait until a healthcare opening comes in, and if you are defeated, of course, the money is refunded back, but it's a small amount. You wouldn't care, I know, but still you would want the job.
Yeah.
We'll keep waiting, but the summary is keep waiting and you give up, you get the money back.
Okay. Also, if I want to relocate from this area, you also look all over the US, right?
Of course. That's easier for us.
Okay.
I mean, I have people getting a job within 10 days when they relocate or when they relocate anywhere.
Okay.
Okay. Mansi, any other questions?
Question I just forgot. Shoot. When it comes back, I'll ask you.
All right. So thank you, everyone. Try to attend other demo classes. We want to start the batch next week by Friday. Shoot me an email. I sent you an email with my cell number. I'm also the owner of the company, so give me a call and let's discuss any other questions you have. So, yep.
Friday is only when you start the class, is it?
I need your decision by Friday this week so that next week we can start the classes.
Okay.
Okay. Okay. So thank you, everyone. Good luck in your search, and please let me know if you have any questions. Okay.
Yeah.
All right. Thank you, everyone. Bye bye.
Bye. Thank you.